Hey, Nifty Thrifty, Dr. Adam Vega back here again with the Nifty podcast. We have another great guest here. You see him in the Facebook groups. He's actually got his own Facebook group, and he had some accomplishments that he just had going as well.
So before we get into this next episode, I want to give a shout out to one of our sponsors, SMC National. Now, SMC National is not just any marketing company. They are actually your growth partner. Their goal is to help you attract more patients, improve your ROI, add full arch implants, scale your practice effortlessly, and stop losing your patients to giant DSOs. So if you're looking to level up your marketing, reach out to our sponsor, SMC National, and ask for the Nifty Thrifty deal.
We got Dr. Tarek Badaway here for us. Tarek, welcome to the podcast. Good to have you on.
Thanks for having me, Adam. Thank you. I appreciate it.
Yeah, so obviously we see you active in the Facebook groups. You and I, we recently connected at an event in Chicago, and just kind of one of those things where you make these connections. So tell me a little bit about yourself. You've been on Facebook for years. What are you up to these days? Give me a background of you.
Well, I am in the admin of a Facebook group, Commander Doctors. As you know, this is a group that me and my friend Paul Goodman of Dental Nachos thought of creating to bring doctors together, dentists together, because we noticed there was a lot of conflict, especially in the Facebook group, dental Facebook groups. There were people not positive towards each other. Like, we're all dentists. Like, as we say, nobody likes the dentist, so we might as well like each other, you know? So we're just trying to bring dentists together. And Commander comes from the movie Raya and the Lost Dragon. Commander was the land that had 5 different factions, and only when those 5 lands come together that they can unlock the magic of Disney, you know? But yeah, we've met, as you know, at the Bob D's conference. We're part of the DIG Advocacy Alliance, and that's something I'm passionate about. I want dentists to not just be there, be passive, just get involved, have a voice, have a seat on the table. So if you have any issues with organized dentistry or with any of the groups that work to influence decision making, because we're not living alone, we're not just practicing dentistry and not get affected by laws around us. And there are adversaries, I would say adversaries or factions that act as adversaries to dentistry and to our profession. So we have to have a say, we have to contribute back to the community that gives us as well. So that's what I'm doing, Commander Doctors. I'm a delegate in the Virginia Dental Association, the Alliance of Independent Dentistry. All of these are groups that I'm putting time into.
Nice. Busy guy. You just got, what was it, diplomat at ICOI as well, right?
Yeah.
So clinically involved. How did you get to this point? I know, especially for younger doctors, maybe starting up, trying to figure out clinically what they're trying to do. Sometimes it's a big ask to say, hey, make sure we're giving back to the profession that's going to give us so much. Where did you start, and how did you end up where you are now?
I'm a foreign trained dentist. I graduated dental school in Egypt in 2004, did 1 year of residency. Then I started my master's in oral surgery. I taught oral surgery in a dental school in Egypt. And then I moved to the US in the early 2010s. Did my residency, AGD, I did the GPR, and I started practicing in Virginia. I worked for a DSO for the first 5 years of my life. I learned a lot during that period. And then I decided that that's enough. I want to be independent. I want to practice the way I want to practice. And then I opened my office in 5 years ago, basically, in Virginia, in beautiful Sterling, Virginia. We have a beautiful office overlooking a lake. All ops look at the lake, and it's we emphasize personalized care. We want patients to be comfortable and not feel rushed. We use all the latest technology in the office to achieve that goal of making it as convenient, as painless, and as uh, non-dreaded as possible. Because unfortunately, a lot of the public perceive the dental visit as an a necessary evil, or something that they don't want to go to. So I think we should focus on that. We should focus on changing the public's perception. And there's a lot of use of technology and same-day crowns, minimally invasive surgeries. You can give your patients noise-canceling headphones, for example. Like, there are small things and big things that you can do to practice dentistry at the best way possible for the patients and for yourself. Uh,
Sure.
yeah, I understand. I do have an associate. There are big student loans on everyone. There are big obligations on everyone. It's taking their time, but this is not going to improve. Insurance companies uh, are not going to reimburse you more if you're not involved, and if you're not holding them accountable, if you're not putting their feet to the fire. Something like the dental loss ratio that was passed in Massachusetts, and then many states are trying to model it, including in Virginia, where we passed a reporting only bill, but that's just to start collecting data to implement dental loss ratio, which is the ultimate goal, to have that.
Mhm.
Um, so I think they don't have the luxury of not participating. Basically, I understand it's a big ask, but just volunteer your time in the beginning, or get involved, get a say in the profession that you participate in.
Yeah. Yeah, I mean it's definitely big when you start looking into it, as a practice owner. It's hard as an associate, right? You show up and you make money. You don't make the decisions on anything. Your background obviously got to where you are now. A lot of surgery and everything like that. Are you a general practice? Is that what you run right now, or whatever?
Yes, I'm a general practice, but I'm what you consider a super GP,
Hmm.
where we do basically everything under one roof, like in the office.
Hmm.
Um, I like dental implants a lot. I've done a lot of CE in implants, and I've done a lot of surgery. And I know nothing, like, you can take the best CE in the world, but if you don't practice and if you don't do, you're never going to get better.
Hmm.
So, and that's why I encourage young dentists as well. Uh, Serve your patients. We don't need to have scarcity of providers that provide certain procedures, especially something like dental implants. If you can place a post and core properly, you can place an implant properly. Just plan well, and it can be done.
And learn. Nice. I've always kind of had the experience of the more I learn, the more I refer as well. So the more I do, the more I send out, the more I see. And so I help the patients out more because I've learned to do implants and other types of things, root canals and all of this. I still, feed my specialists and still do all of that. I probably refer out more now than I used to. And so in the world of, being a GP, super GP, whatever it is, and getting into organized dentistry, we see it all over Facebook. People are huge of go fee for service, get out of network, get out of everything, out of, whatever you can. What is your advice there? I mean, it's always nice to do that, but for me, I'm heavy into PPO. Do you still take a lot of insurances? Are you moving out of it? How do you think that jives with saying, let's be involved, but let's also get completely out of that area? I mean, what are your thoughts on that kind of approach?
I don't think there's a cookie cutter approach to this. You can't, what works for your practice might not work for my practice. The demographics are different. Ideally and ultimately, everyone would like to be a fee-for-service dentist and get paid up front, no questions asked, the maximum amount. But that's not a goal in and of itself. You want to serve your patients, like what you're saying now. You refer now more, that the more you know, the more you refer, because you're more knowledgeable. You know which cases you can do and which cases you can do. And that's the ultimately, that's what we want to do. We want to practice to the best outcome for the patient. If you can do the service well, and you can do it as well as a specialist does it, then do it, definitely. Uh, as far as fee for service and PPOs, I still take PPOs. Um, Again, it's hard with the stagnant reimbursements, and that's why I'm saying get involved and get those insurance companies to pay their fair share of the uh, patient care. The dental industry is, you know, relies on us as the dentists. So we should have the ultimate say in that, not special interests and lobbyists for insurance companies, for example. But no, I don't think you should go fee for service without studying your case very well. And still, you can do good work with PPO insurances. You just need to know what works for you and what doesn't work for you. What works for me, what not work for others. You know, and there's a bit public perception that I need to do what my insurance tells me. And if the insurance doesn't cover it, that means it's not medically or clinically necessary. And that's wrong. We need to educate the public on this. And we need to get this middle man kind of friction between us and the patient. There's nobody that saw the patient except us. We're the most knowledgeable, we're the most caring towards those patients. So we can't have insurance dictate treatment, for example. But at the same time, don't get out of insurance and bankrupt yourself just because you saw it on Facebook, Like you have to know your situation.
Yeah, for sure. You mentioned Paul Goodman, over in Dental Nachos. He's huge in communications and what you say, and don't say weird doctor stuff. He has all his own little ways of saying it, but that's huge. And to your point, being able to communicate to patients and have them grasp and understand what we're saying. Do you have certain scripts or certain things you do in your practice or work with your team to say, hey, we don't say that here, we say it like this? Do you have any examples like that?
Yeah, I definitely hear what Paul says. I try not to say version this or, big dental lingo. Yeah, definitely try to communicate with patients to the level they understand. Still not talking to them as if they're children, but at the same time, just spell it out in ways that they can understand and relate to. And it comes to patient education, right? You have to have enough time for patient education. I see some young associates now are given 15 and 20 minutes to do fillings, and they have two hygiene columns on the side. And I was in that environment as well. I know how it is to have your schedule packed and you're trying to do as many procedures as possible because the reimbursement is low, for example, and we're insurance heavy. So yeah, as long as your goal and what you're working towards is serving patients properly and giving them the time, the same level of healthcare you want to receive yourself, if you give it to your patient, that's really my motto.
Yeah, getting out there. I mean, to your point, nobody wants to be at the dentist, right? So if on top of it, we're not communicating well and we're, not being efficient, not doing things, it's not good for us as a whole. So I can see in your career path, right, being involved, running business, doing this stuff is huge into clinical dentistry. As younger doctors or doctors trying to be more involved and do things, how do you kind of balance that aspect of saying, getting really, really good clinical, and then also trying to get more in onto the business side, the insurance side, the organized dentistry side? How do you balance those two things? And do they come in seasons? Do you have to get really, really good at one before you can really jump into the other? What are your feelings there about balancing those two kind of odds and ends?
I think, like you said, it comes in seasons, kind of, because you're still in the beginning trying to get your reps in clinically to do procedures, to become basically unconsciously competent at them. Everything you get into in the beginning, you don't know what you don't know, and then once you become unconsciously competent at most clinical procedures that we do, then it relies on your team. If you choose the right team, and if they're helping you out, you're delegating as much as possible, which is one of the things you shouldn't do as a dentist. You should know how to do everything, but don't micromanage everything. Don't be too involved. As long as you choose the right people and you trust them, they can then do the job well and free up your time to do more things or care about more things like organized dentistry or having a say in your profession. And you don't have to have a lot of time to be involved in organized dentistry. At a minimum, join your local society and just comment whenever you can. Even on Facebook groups, that's a form of speaking your mind. And yeah, you put in as much time as you can, but yeah, it comes in once you're more capable of clinical dentistry and you have a team that runs the office well, even if you're not there, then you will have more time to do these activities.
Nice. Delegation's big. It's hard. Dentists, we're told to, solve the problems, do everything. And then when you have a team member that's learning or doesn't quite do it your way, it'll drive you nuts. But I think that's huge, especially like you said, to kind of be able to focus in on these other things. So you're big into clinical, you do all these things. What are some things that people need to be doing in their practice to improve themselves, to help their patient base, to help their community a little bit more? I mean, what are some things in the practice that you think, especially GPs, need to be maybe changing or doing differently in this day and age?
Um, I don't think there's much that people can change. I see most people practice at a decent level, at least the ones I know. But if I would have any advice is to learn what you like. Learn what you like in dentistry. Dentistry is broad. So see if a certain discipline or certain branch interests you and do education on it, learn about it, do CE on it, practice it, and do it to the best of your ability. I think that would be my best advice for people to do good clinical work. Embrace technology. Definitely embrace technology. Don't be left behind because technology makes our lives easier in many ways. Communications with labs, doing things same day for patients, or speeding things up, making things more precise. All of that technology helps you do. So embrace technology and connect with other dentists. Depending on where you work, don't be alone. Dentistry can tend to be a lonely profession, and having a good network of like-minded dentists that you can support each other. Sometimes dentistry is tough. You're working inside the patient's mouths for many hours every day, and there's big liability, and there's things you can't control, and all of us have gotten clinical complications one way or another. You should have a support system of other dentists that you can talk to and share with them what you're going through. Don't be left alone in this, because we see, unfortunately, many people fall into depression and big problems, and we don't want that. We're together in this, and that's another reason I created Commander Doctors as well. Is there was a lot of bullying and talking badly to each other as dentists, and we don't want that. We want to be together.
Yeah. Yeah. Facebook's been amazing. I mean, you make these connections, you and I and everybody else we've met on there, but you get those times where you have to, disconnect from Facebook because you get kind of bogged down in the negativity or the bad things going on. And I get it myself. And, like you as well, you have your groups where you have to, be able to dig through and find the good stuff. So being able to do that, I see that being very connected with organized dentistry as you speak about a lot. Somebody like me who's, I've been in the ADA, I've been out of the ADA, I've never really stayed in one spot long enough. I am now to really get involved with local, groups or anything like that. Where do you think it starts, as somebody who maybe is just getting into dentistry or, kind of been in dentistry for a long time? Where's kind of the easiest place to just kind of start to get into organized, get into these communities, and kind of experience this new world, I guess we're looking at with the connectivity that we have?
I think Facebook makes things easier to at least start, dip your feet in the waters of learning about everything. And in my experience, a lot of state societies are looking for people, like they're actively looking for people. Membership is diminishing, and that's another thing. It won't be too difficult for you to get involved if you want to be involved, if you're willing to volunteer your time to advance the profession and influence change, then you will have a seat at the table, basically, like we say.
Nice. And what does being involved include, I guess? Is it if I'm there just trying to connect and network, is that be involved? Or what else? What other kinds of things can dentists be involved in, I guess?
Well, learn about what the legislations being introduced are. What do we want to work on? First start with what are your main issues? What would you change if you were in a position of affecting change and making decisions? And think about that. How would your life improve as a dentist? How would your practice improve as a dentist? What do you need? And then multiple dentists come together, they talk about the same issues, if there's common issues. Like, for example, we have this dental insurance grievance tracker on the Virginia Dental Association website, where you can, if you have any issues with dental insurances, if you feel that you've been wronged, like the disallows, for example, which I don't think are legal, and other things that you have, if you have issues, you can submit that on the dental insurance grievance tracker, and it will be heard, and it will be acted on. That's one way you can get your voice out, or just connect directly to your state society or to one of the Facebook groups that care about organized dentistry and want to affect change in that, and just have your say. That's basically being involved. Your freedom of expression, which is very valuable. You should be able to have your say in what happens in your profession.
Yeah. Yeah. I mean, when I look at that, you're trying to organize time, you're trying to get all this stuff done. Finding the time to do these things. How far in advance would you say your average calendar is looking out? So we're all at the beginning of the new year here, and I'm looking at kind of my education budget or my time for the year, and I'm building out my calendar, and I'm already got stuff through December. How far out are you planning, your clinical and your involvement in these different societies? How far are you looking for this?
It's usually within 3 to 6 months. That's what I know, what my commitments are. You're probably a better planner than me, that you have it all until December, but it depends on your goals, depends on what you want to achieve. Definitely, like you say, it's important to be organized and to have an idea about what your goals are for the new year and how you're going to achieve them. I will achieve them by attending this CE, by attending this meeting, by going here or going there, and setting a budget for it. Definitely.
Yeah. Good. And what's on your calendar for this year? What are some big things that you're looking to get accomplished or be involved in?
So in January, we have the House of Delegates meeting in Richmond, the capital of Virginia, with the Virginia Dental Association. In March, we have the AID, the Alliance of Independent Dentists, which is a group that I care about. They have their first annual symposium. It's all about the business of dentistry, teaching dentists the ways of running their practice efficiently, how to get the most reimbursements from insurances, how to transition from PPO to fee-for-service if they would like to. There are multiple good speakers: Rick Garofalo, Sandy Perdue. There is Dr. McNamara, an emergency medicine doctor, physician. There's a movement now, Take Medicine Back. And these are all good things to learn, because we don't want to become like where medicine is now, where most of it is corporate practice, and even out of the 20% of independent physicians, only 12% are members of the AMA. We don't want the ADA to become irrelevant, but at the same time, we need to improve what it does. So that's one event I'm going to, the AID annual symposium in March in DC. Also, I have my days of volunteering in the community clinic. Those are also mapped out for the next few months. And I have the ceremony for the fellowship of the ICUI that I just received.
Nice.
That's going to be in New Orleans as well in February. So yeah, that's basically it.
Congrats. Yeah, that's a big one. Awesome. Well, obviously we could see your passion, right? And kind of how you got to where you are today. And I think the big thing that you're kind of pointing out here is the community, the networking, getting out there and meeting people. I know for me, that was one of the big things that I've noticed, that when I'm out and meeting doctors and going to events, and even if, it's a local CE with the local, oral surgeon, where I think that, hey, I've got this, I understand this, I don't need to go to that. I get more out of going to that event and being around people and just having the conversations and bouncing off of them and seeing what's out there than I do maybe from what is actually being taught sometimes. And so I think it really is just making that investment in time and energy and just planning out and saying, hey, I'm going to make sure that I get out once a month, once a quarter to go and do something. I think that's huge. And then, like I said, they kind of organically become more, you get busier, and then you're trying to figure out, hey, what am I doing this month or next month, right? Oh, cool.
You're absolutely right. Yeah, the being in events, as you said, you can talk to someone who's given you their pearls of practicing for so many years. there could be something that lights a bulb in your head, and it makes a big difference in your practice and in your life. So definitely, the importance of community cannot be understated.
Awesome, Tarek. I think we're going to need you have you back on for another episode, because I can see we have a lot of different areas where we can get a lot of great stuff from you. But again, in the sake of kind of getting to know people on Facebook a little bit better, to have that community, people we can reach out to, I know you're one of those ones that people will be able to. Let's go ahead and get this wrapped up here with our kind of 3X level up we like to talk about here at the end, kind of a speed round. We'll run through 3 different things here. So what's a tip or a tool that you couldn't live without? Something that people need to know about.
I couldn't live without my team, my team in the office. They have to be. You have to choose the right team in order to move forward.
Perfect. There's a whole new podcast episode in and of itself as well. I love that, man. That's a good one. What about a past failure? What's a mistake that you've made in the past that you've learned from and you live with today?
It might not be a specific mistake, but if you see an opportunity in front of you, don't let it go. Don't get analysis paralysis and just not make decisions. Try not to miss opportunities when they present, because that can set you back many years.
Love it. What do they say about luck? It's where opportunity and preparedness intersect or something, right? When you're ready for it. I love it. All right. And what about advice to your younger self? It seems like you've kind of obviously been through a lot of different stages, the seasons of life. What's something, if you could go back, that you could teach or give yourself advice on? What would you give?
Advice for my younger self?
You kind of just did with opportunities, right? Yeah.
Yes, that's exactly it. But yeah, that's it.
Awesome.
Yeah.
Awesome. Dr. Tarek Badaway. Awesome. It was my pleasure to have met you in person and to be able to connect, and what you're doing now, kind of learning myself of what you're doing. I definitely want to be able to help you any way I can. So if there's people that can get out there and connect with you, where should they go? How should they get a hold of you?
You can see me on Facebook and Commander Doctors Facebook group. Or westlakedentalva.com. That's the office website.
Perfect. Awesome. Nifty, here's a guy that you want to know. Obviously, all these groups come together. We got nachos. We got, in general, we got business, right? All of these types of things. This guy, you see him everywhere. He's doing big things. We're going to have him back on here in the future. Congratulations to you and everything that you're doing. Nifty Thrifty, thanks again. Here's your faces of Facebook with Dr. Tarek Badaway. We'll talk to you guys next time. Thanks, Doc.